Hello, everyone. The topic we have chosen to present on today is the nationwide nursing and PCP shortages. The healthcare organization we have chosen is the American Nursing Association, and our leader is Jennifer Mensick Kennedy. So, a little bit of an introduction or background on this issue could be dated back to the Great Depression, where many registered nurses were unemployed. But because there were so many hospitals open, they were able to get jobs with ease because of the high demand. But it wasn't until during the mid 1930s when the nursing shortage began because of factors like technological and economical advances. Some of the root causes to nursing shortages would be heavy workload and burnout. So, working in a stressful environment with lots of patients is often more than a provider can handle. They have to work long hours and don't have much time to take a break in between. A most recent example of this could be during the COVID-19 pandemic, in which many nurses were constantly overworked and treated poorly. This in turn caused many nurses to leave their jobs, further increasing the shortage in nurses. Workforce violence does not necessarily mean physical, more so verbal, psychologically, or even harassment directed towards nurses in the workplace. This could include incidents such as threats, verbal abuse, bullying, or harassment by patients, their families, visitors, or even colleagues. Aging population and workforce aging can be grouped into one. As there are many people who are making it to older ages, there is a more demand on healthcare services. Not only are their patients aging, but the nurses are also aging. The article Nursing Shortage by Haddad and others explains that 1/3 of the registered nurses currently in the workforce are over the age of 50 and are expected to retire within 10 to 15 years. Some of the effects that nursing shortages have on society is quality of care. So due to the shortage of nurses, the patients will not only have to wait longer to receive help, but they will also have less time to interact with their provider. This prevents providers from establishing relationships with their patients, which in turn decreases the quality of care. Reduce access. Due to the shortage of nurses and the longer wait times, it is harder for some people to get the access to healthcare. Consequently, the patients that do not get access to healthcare suffer higher mortality rates as well as an increased chances of disease and sickness. Increased costs. As there is less access to healthcare, costs are increased. This further impacts patients because there are so many people who cannot afford healthcare, especially in the United States because of the high costs. If prices were to further increase, it would make life even harder for these individuals. Furthermore, there would be a higher mortality rates and increased chances of sickness and disease. As stated in our introduction, the organization we have selected is the American Nursing Association, which represents the interests of the nation's 4 million registered nurses. So what exactly do they do? One, they ensure universal access to a standard package of essential health care services for all citizens and residents. Two, they optimize primary community-based and preventative services while supporting the cost-effective use of innovative, technology-driven, hospital-based services. Three, they encourage mechanisms to stimulate the economical use of healthcare services while supporting those who do not have the means to share in costs. Four, they ensure a sufficient supply of a skilled workforce dedicated to providing high-quality healthcare services. So, what exactly is their mission? Their mission is to help foster high standards of nursing practice, promote a safer and ethical work environment, strengthen the health and wellness of nurses, and advocate on healthcare issues that affect nurses and the public. So, a little bit of background on this organization could be dated back to 1896 when it was first founded. The ANA has empowered nurses for over a century, and during times of dramatic reform, the American Nursing Association has safeguarded the needs of healthcare consumers and has held a long-standing principle for health systems reform. When the Nursing Association alumni of the United States and Canada first gathered, they assembled at the Manhattan Beach Hotel near New York City. Fewer than 20 of the delegates were nurses. When the organization became the ANA in 1911, the ANA was already fighting to gain the respect they deserved. Policymakers began to recognize the importance of valuing nurses in healthcare, and through annual conventions and academic journals, the shared wisdom of nurses inspired others to join the profession. Over the past 100 years, the ANA has built on this spirit of solidarity and action. Protecting the interest of nurses across the United States is an integral part of the American Nursing Association's legacy. So, the American Nursing Association's leader is Jennifer Mensick Kennedy. She was elected at the start of 2023, right at the tail end of the height of COVID-19 pandemic. As the dust settled, she took her position in office and set forth a plan to utilize new resources to improve the welfare of nurses nationwide. With a deep academic background, she has a PhD, a master's in business administration. She is a registered nurse, a board-certified advanced nurse executive, and a nursing fellowship. She is certainly fit for this position. Additionally, she has background experience working with the ANA for 9 years before being elected. Her previous experience includes being the treasurer and second vice president. Well, with all of these credentials, how exactly does she lead? Let's go ahead and take a look into that. So the first skill that she uses on a day-to-day basis is respectful leadership. She constantly uses loving and supporting language for nurses nationally and works to better the nursing community. She has publicly spoken to combat racism in the nursing community among employers and advocates for nurses receiving a higher wage. She also continually promotes mental health resources for nurses, ensuring that they receive the care they need. In all, Jennifer does a wonderful job of showing she respects those she leads in the nursing community. Another skill she utilizes is adaptability. Jennifer has plenty of background in various fields, which she draws from to better perform on new tasks. Some highlights in her work experience include her time as a system director for Banner Health of Arizona and as an assistant professor at Oregon Health and Science University School of Nursing. Not only does her varied background make her adaptable, but so does her constant search for new information. She has addressed hot topics such as the use of telehealth appointments for patient care and sees the internet at the same level as other utilities such as gas, light, and water. Another skill she utilizes is effective collaboration. As the leader of a huge organization, Jennifer has the ability to collaborate with many different health organizations. One issue that nurses face is being short-staffed, leading to nurses having to care for more patients than they should have. Jennifer expressed these concerns with policymakers, and currently there have been about 18 states who have put in place staffing legislation. Jennifer hopes to have federal laws in place to ensure that healthcare facilities are being staffed correctly. She has collaborated with policymakers, allowing there to be positive changes for nurses. In Chapter 14, collaboration is defined as having shared visions and togetherness. Jennifer does an excellent job of sharing issues nurses are facing and making changes that will benefit them in the long run. If Jennifer did not have effective collaboration, the nurses would continue to face the same issues they do today. So a negative trait Jennifer may have could be considered circumspect. Jennifer was once asked what the most challenging part of being the president of the ANA is, and she stated, "The most challenging part of being president is watching what I say 100% of the time." Jennifer is very circumspect about her statements because she is worried about how others will perceive her words. She avoids conflicts by being cautious of what she says. This is a negative trait to have because could be some missed opportunities, difficulty in building relationships, and slower decision making since she's constantly worried about what she's saying and what others will think. As a leader, it is important to learn how to deal with conflict because not everybody would have the same opinion. As learned in Module 6, Chapter 16, conflict management describes how somebody could use direct speak. And direct speak is defined as speaking in a straightforward manner without being insensitive. Jennifer could make statements without beating around the bush, allowing for clarity, enhancing relationships with others, and decreasing misunderstandings. Also stated in Chapter 16, conflict could be beneficial because it brings awareness to different opinions, which allows for growth in the organization, in any organization at that. As well, conflict can promote resilience because being able to navigate through disagreement can give one confidence and self-efficiency when facing future conflicts. And that is it.